Welcome, I'm Dr. Perry from Farmington Family Dental. Today I'm here to answer some of the most common questions I hear about full mouth reconstruction, redoing an entire mouth and making it look nice again. Full mouth reconstruction is really just talking about the extent of the work done. Typically when you go into the dentist you hear about a crown here, a filling or two there, and it's fairly limited as far as what needs to be done. A full mouth reconstruction is kind of like in a house, taking all the drywall off, down to the studs, redoing the drywall, maybe we're redoing a roof and some siding too. It's redoing a whole bunch of the mouth at a time. And typically we keep the foundation material, sometimes we redo, but typically we're keeping what we have and just restoring the facing surface or the veneered surface on over the top of it. That can be done with like dental veneers, or it could be done with dental crowns, or a combination of those. To get you to where your smile looks nice again. It looks nice and even. We've taken care of any spacing issues that are there, and you just have a beautiful smile again, regardless of where you started in the process. Great, so candidates for full mouth reconstructions are people who aren't very happy with their mouth at their core. They're either having difficulty chewing, they're seeing things breaking down over time, and their dentist has said something like, well, let's just watch on that, we'll see how that goes, you'll end up in a set of dentures eventually. Those are the types of people that typically there are other options where we can fix it up, but maybe your dentist hasn't talked about them with you. Oh, disqualifications. So who is not qualified for doing a full mouth reconstruction? Anybody who I don't think can take care of or maintain the work once it's done. That does not make sense to fix it up if there's some sort of systemic health issue that's going to cause you to lose your teeth either way, or the foundation in and around your teeth isn't healthy and stable, like you have active periodontal disease that we're not going to be able to get under control. Those are things that I would say, hey, we shouldn't be doing this. We really should be taking teeth out or exploring another option or getting it under control first. The treatment options for full mouth reconstruction really, they're pretty vast about what can be done and how it can be done. In general though, it's putting crowns or veneers on things and changing the look or the shape or the structure of the tooth that you see when you smile, or changing the structure of what you use to chew with so it's more stable and better longevity or better lifespan for it. General dentists are qualified to do full mouth reconstructions. I think the limiting factor seems to be, have they gotten the training that they need to be confident and competent in delivering the result you're looking for? Oh, everything on doing a full mouth reconstruction depends on that first step. That's the consult appointment. It really deserves some time spent with the dentist, probably 30 minutes or even an hour, talking about what the issues are and what the solutions that are available for that. And finding a plan that's to your liking to deliver the aesthetic result and the functional result that you're looking for at a price that works for you. Full mouth reconstructions vary in how long they take. So it could be anything from a day on up to a couple of months, or even in some cases a year or two, depending on what all is involved with restoring what once was. A full mouth reconstruction at its core is fixing everything, fixing the foundation so your teeth last longer and look better. And that can be quite involved for some people, or for others it's fairly simple or straightforward. Full mouth reconstructions can be done comfortably either with local anesthetic, like you're used to, where we just get the areas we're working on numb, on up to being fully asleep. Some people, you probably know who you are anxious about dentistry. Some to a point where it's been keeping you from being able to have the work that you need in your mouth. And for people who are in those boats, well, there are sedation options where we can put you all the way to sleep, like general anesthesia, or things like if you're having an appendectomy or a surgery to remove your appendix, where you're not even awake for it, you're not aware of what's going on, you have the work done, you wake up and it's done. That can work for a lot of people if you're pretty nervous about things. Just talk to me about it. I'd be happy to help you with that. Ooh, healing from a full mouth reconstruction is typically fairly quick. Typically these types of procedures are done just on the tooth itself and are done in a way where we're doing veneers or crowns or some combination of that. When we start involving implants or dentures, that takes a little bit longer to do from start to finish, and the healing period can be anywhere from a couple of days to a couple of months, depending on how things go. But in all cases, even with implants, even though the implants take about 6 months to heal in most cases, that healing period isn't a sore period. It's just waiting for the bone to grow in and around the implant. And the healing phase is really only the first 2 weeks or so as the tissue's closing over and healing over top of where we put an implant in. There can be special care instructions when we're doing a full mouth reconstruction. That depends individually on what you needed to have done and how we approach it. As a dentist, I will talk to you about those special care instructions sometimes right up front so you're aware of them, or at the day of the procedure. I'll tell you about what happened or is about to happen and what care you're going to need to do in taking care of it. Full mouth reconstruction lifespan. Sometimes people ask, well, is it going to last forever? I would never say anything lasts forever out of a matter of principle, because I don't think that it does. Even the original work has issues, and I don't think in a lot of cases the original work was the best that's ever been done. I happen to have some faith in that regard, by the way. All that said, lifespan of a full mouth reconstruction should be a pretty good long lifespan. I'm expecting anywhere from 15 to 20 years on average out of each individual tooth we work on. If I'm expecting less than that, I will let you know at the time of diagnosis or when we start treating it. If it goes different from what I thought, I will talk with you about it. In general, when somebody's considering a full mouth reconstruction, I have yet to see somebody who's had that procedure done need to then go to where we're extracting and removing teeth and replacing them en masse. Sometimes we'll lose one or two along the way, but that's not the end of the world as far as things go. I'm expecting as a whole the work will last a good long time, and probably until you don't need it anymore. Dental insurance is pretty savvy about how they approach large treatment plans like a full mouth reconstruction or implants or things like that in dentistry. What I mean by that, accountants know their business. They know what money comes in versus what money goes out, and it's fairly simple for insurance to say, as a category, we won't pay for this. When you come in and we start talking about doing something and we solidify the plan that's right for you, I will tell you about the insurance, what it will do specifically in your case. Sometimes I see them participating in a meaningful manner. Other times I don't. It really depends on the insurance that you have and the extent and what we're doing to deliver the treatment that you need. Like, are we using implants or crowns or veneers, or how are we doing it? In general, what I would expect from insurance is that you're hitting your year maximum. Usually those sit anywhere from $1,500 to about $2,000, and they'll contribute towards the case, but it's certainly not going to cover all of it. So people ask, how am I going to pay for this? How is this even achievable for an average person to have everything fixed back up? The most common way that I see people do this is they'll get some type of financing, whether it's our in-house financing we offer, or doing something like a mortgage, or putting a lien on the car or the house or something like that. All of those are options that I've seen people use successfully. And what it comes down to on this is, how much is it? The average full mouth reconstruction is sitting anywhere from about $10,000 on up to about $30 or $40, depending on how we accomplish it. At those numbers, you can obviously see that's like a new car. And sometimes people ask, well, how do I pay for that? Well, it's usually the same answer as what you would do if you needed to buy a new car. Finance it is typically the option people go with. Right, so you can schedule an appointment to come and talk with me by simply giving us a call. Our phone number is 573-756-5760, and that's here at Farmington Family Dental. If you give us a call and tell the secretary that's what you want to do, you want to look at fixing your teeth, she'll get you scheduled with a consult. Those consults for an implant or for a full mouth reconstruction are done at no cost. We will take x-rays and basic records to see, do we qualify here, and start that conversation. At that point, there's no commitment, by the way. I really just want you to see what the options are and see what fits right for you. Okay, so it was great talking with you all today about dental full mouth reconstructions, about fixing things up. If you want to talk more, you want your specific questions answered, or see what plan is right for you, give us a call. Our phone number is 573-756-5760. You can call us at Farmington Family Dental, and we'll get you scheduled in for a consult. That consult is no cost. We'll do the records we need to do to get you the answer of what treatment we would recommend, why we'd recommend it, and what long-term result is doable for you. We'd love to see you. Anytime, give us a call.